This is an absolutely worrying story, and the kinds that is getting frequently reported. So often, say since last year. An 18-year-old college student has died in Madhya Pradesh's Indore after suffering a silent heart attack during a coaching class in Madhya Pradesh's Indore. Look at these visuals very carefully. He was sitting in a class which was packed with students. He was preparing for the state PSC exams, is what we are getting to know. These coaching classes were for just that. And while he was attending the class, you see one of the students reach out to him. They help him. They ask him if something was off. You can see the signals there. And then suddenly, he just completely collapses. And there's panic among the students who try to stop the class and call the teacher or the professor over. This has been captured entirely on the CCTV footage. Massive concerns around this. And remember, this is not just one-off incident. This comes just a week after a 36-year-old engineer died of a heart attack while playing cricket in Noida last week. These are those visuals. He collapsed while running towards the striker's end. Just in a matter of a week, a 18-year-old and then first a 36-year-old and then an 18-year-old. But this is also not the only cases. Last year was full of these cases, particularly towards the end of the last year. Why are such cases being reported more? Let's just try and dig deeper and understand this. I'm being joined right now by Khanna, a senior cardiologist and advisor to Apollo Group of Hospitals. Thank you very much, Dr. Khanna, for joining us. I'm hoping you've seen these visuals. These are very, very disturbing visuals. These are the students, 17, 18, 19, 20 odd years. This is what the class range perhaps would be, fresh out of college, preparing for these competitive exams. And you have this 18-year-old completely collapse.
Yeah, Sneha, you're right. These are very disturbing. And of late, all of us are observing, quite a increase in the incidence of these heart attacks and cardiac arrest in young people. But, when we call heart attacks, we need to be clear heart attacks and cardiac arrest are two different things. A heart attack can lead to a cardiac arrest, which is the electrical stoppage of the heart functioning. And the other one is it can also happen because of electrical short circuiting, which is genetically present in many of our younger guys, and also which is triggered by a lot of stress and, the artificial lack of sleep, artificial lifestyle, and some stimulants, intake of stimulants, coffee. So those are also the causes, excessive gymming. So we need to be very clear when we're talking about heart attacks. It could be a cardiac arrest, or it could be primarily or a cardiac arrest secondary to a heart attack.
Right. We'll get to other aspects much later, but if you look at this classroom also, what should something be done when an incident like this happens? And it's perhaps very important for all of us to know this, because this is being reported so often. This may just happen to anyone around us, including our own selves.
Yes, yeah. So that is the question. I mean, that is what is required. If you see this visual, which I'm seeing right now, people are observing, and to whatever I see, they see a guy, one of their friends falling down. What can save this life is an cardiopulmonary resuscitation. So every individual, every schoolboy, every college person should know how to resuscitate in case a person, a bystander, has a cardiac arrest. And what we do is we just give a closed cardiac massage. We maintain the airway and give artificial respiration. And if you would be surprised, at least 60% of these patients can be saved forever if a timely CPR is initiated. And this should be the teaching right from school levels to every walk of life. This is the first thing to save lives in case of sudden cardiac arrest.
Right, that's an important point, and I myself have been a witness of someone just coming back to life because of CPR. I've been an absolute witness to this, doctor. But when you talk about issues like this, you may call it artificial living, and that's something that you really said, and I understand where that is coming in. But that's really the new reality. Less sleep, odd hours of food, not being able to eat at regular intervals, not being able to eat the right kind of nutritive food, access of the right kind of food. There are so many aspects to this, but this really is the new lifestyle. Work demands it, competitive exams demand it, because there's no way to work around this. What would you then suggest?
Yeah, so this is the new lifestyle, and but this is not the new normal. You have to understand these are the pressures of the surrounding and the lifestyle, but the body doesn't react to it unless you have slowly tuned and you got accustomed to this sort of a lifestyle. What is very important, the youngsters of today or from even the elders have to understand you are living. First, you need to live to work or to undergo any stress of work pressure or in your profession or in your family. You need to live first. For living, you need to have a proper you know sleep pattern. You need to have a proper diet. You need to have relax yourself and be out of this catecholamine surge, or which is now the new norm. People want to be in a catecholamine surge. People want to be in a caffeine surge. Just keep drinking coffee or stimulants or drugs and just keep working. It doesn't work out for a long time. This is not the way it's going to go on. And we are losing a lot of our young, productive individuals just because of this stress. I mean, I would not. This is what it is now, unfortunately, but
So
this is
what
not
what
what
what do
should
you
be.
suggest? I mean, lifestyle change, yes. Lifestyle change, yes. But is that the only answer? Do you have anything else? I mean, to anyone who's listening to you, is the answer lifestyle change? Is the answer that you just have to get to manage yourself and your life better, or is there a way out?
Yes. So the first thing is you need to manage yourself better, but there is a way out. If one, many of these individuals, it is not that everybody has it. They do have a disease in progression. They should get their risk factors checked. If there is a family history, it should be, these people should be checked for their cholesterol, diabetes, insulin resistance, lipids. They definitely should. If they are smoking, they have to stop smoking, and taking a lot of alcohol or stimulants. They should take proper diet, especially in people where there is a family history or there is a higher risk factor of this. If there is a history of
Right.
sudden death in the family, again, these patients normally do not have a heart attack, but they have a cardiac arrest. So they should be tested. They should go to the doctors. If somebody in the family has a sudden cardiac arrest, the siblings actually should be properly checked up by a cardiologist to make sure that they are not prone to such sort of diseases. And if they are, what should be the lifestyle changes? Apart from that, one has to understand this is the
Doc,
new, not norm, this is the new demand of the present, society or the present way we work. We have to take time to for ourselves in between and relax and be sure that we are not ignoring our early signs and symptoms for this sort of disease.
right. Doc, one question. How about stereotypes? And it may sound such a vague question, but it's so prevalent in our society. If a person is of a certain body type, woman or a man, you are seen as healthy. If you defy that body type, you are superficially seen as unfit. Whereas fitness and health is so much more intrinsic, it's so much more deeper. It's how you train yourself every single day and keep yourself beyond breaking the stereotypes, particularly for how the youth really look at it all.
Yes, so Sneha, you need to understand 6 packs, 8 packs are not healthy for heart. You may develop it as as a hobby, or you have to work hard for it. But everybody who just wants a 6 packs or 8 packs goes to a gym instructor, takes whatever is possible in terms of stimulants and steroids and the energy foods, and tries to build that in a very short period of time without a good training, actually will build your packs, but it will spoil your heart, and it will make you prone for heart attacks, for strokes, and many more things, and sudden cardiac arrest. So that is
Right.
not the sign of a healthy body or maybe a healthy heart. You need to understand that one, the way our ancestors were living, every individual should have a proper diet, proper nutrition, balanced life, and not a very sculpted body. but a good body, not a lot of fat around your waistline. But a good body is a good body, not a sculpted body is not a very healthy body.
It's a last question, and one really finds 24 hours very less in today's time, and that I'm sure as a doctor you also might have felt that many times the demands and rigors of a profession, whether you're a professional or a student, seems to be just unmatchable at some times. But still, between all of this, how important is exercising for your health?
It's a must. It's more important than food, I would say. See, exercising not only trains your heart, not only lowers your cholesterol, blood pressure, and the incidence of diabetes and lipids. It is also a very good relaxant. It secretes a lot of serotonin. It makes you feel good. It gives you a lot of stamina and ability to endure all these stresses of life. So exercise, if I have to prioritize, it is even better, or it has a higher level than food. One should sleep well, exercise well, and maybe eat less. So that is how less means not less than what is required, but less than what is overeating. Most of us, if you really look at our diet, we are either not eating properly or we are overeating in terms of our whatever exercise we are doing a day.
Right. Thank you very much, Doctor. Thank you for joining us with those advices. I think the more we get, it's only better. Somewhere we all need to just ingrain it in our systems. Knowledge may be there, but it's very different to have it in your head and to really internalize it. Thank you very much, Doctor, for
And I
joining
must
us,
also tell you, when
even
I'm
as we wish
speaking
the
this,
best to the
there are a lot
family
of
of the lost one. Yes, please.
there are a lot of our doctors
Yes,
who are
yes, Doctor,
also
please go
falling prey
ahead.
to this sort of acute heart attacks and cardiac arrest, because doctors do advise, but they are not following this advice. So it is a universal advice for everybody.
Absolutely. Thank you very much, Doctor.
Thank you.